what topics they will be covering. So come, let's go. Come join me. So we are today in motherhood. So Sonia has invited all of us, all the influencers and all the mothers and girls. She has invited all of us. So let's hear what's all about. So I'll welcome Sonia. Please come, Sonia.
Yeah. Hi everyone.
Yeah. So hi Sonia. What's all about? आपने आज motherhood में हमें बुलाया है. What is all about?
It's all about women health.
Okay.
And we discuss about pre-menopause basically because
Acha.
now we are most of us in our 40s and
Yes.
I think it's very important topic for women to
Correct.
learn about what the symptoms in pre-menopause, what the effect, con and causes.
Okay,
all we
that's
discussed.
great. That's great. So it will be an informative session, Sonia.
Yeah, it will be very informative.
That's great. That's great. So I would like to invite Preeti also. Thank you so much, Preeti, for inviting all of us. So जरा बताइए ये सेशन किस बारे में है? We are so excited.
ये एक्चुअली हेल्थ के बारे में है. हम लोग अपने घरों में रहते हैं, हमें पता ही नहीं चलता कि आगे मेनोपॉज होने वाला है, प्री मेनोपॉज है, उसके बाद क्या करना है, क्या केयर है, कुछ हमें पता नहीं होता. पता होता है तो आसपास हम
डाउट्स होते हैं, फ्रेंड्स से पूछ लिया,
होता है, वो कई बार ठीक होते हैं, कई बार नहीं भी होते.
Correct. Let me tell you about Dr. Shweta Wazir. So Dr. Shweta Wazir practices as a senior consultant of obstetrics and gynecology in Motherhood Hospital, located in Sector 57. She has significant expertise in pregnancy care, obstetrics, gynecology, laparoscopic gynae surgery with a commendable experience of 20 years. So she is celebrated for her innovative treatment methods and her professional repertoire, high-risk pregnancy care related to cervical treatments, hysterectomy, tubectomy, infertility evaluation treatment, and gynecological disorder management, menopausal care, and maternal care are some of the key areas of her expertise. So what is menopause? Menopause is a natural biological process in women marking the end of their reproductive years, characterized by the permanent cessation of the menstruation. So it is a normal part of aging, typically occurring between the age of 45 and 55. So menopause is defined as the absence of menstrual period for 12 consecutive months.
It becomes on the lower side. It just comes for 1 or 2 days. And it is not like that. In one cycle it was 20 days and in the next cycle it came after 40-45 days. Okay, that is something which we need to look at. Why? But if it is coming in a set pattern and again the cycles are getting shorter, initially I am okay with that. I would not really want to intervene, right? The second is very important is weight changes. Okay. See, no matter how much you are taking care of yourself, during the pre-menopause and the perimenopause phase, every woman tends to gain weight. Why it is? Because our estrogen getting declined, it's difficult. The peripheral part of our body, all the androgens, they start getting converted into fat, and all that stimulates our body fat, and it is difficult specifically, on the tummy. We always feel that, okay, why we are getting heavier on the tummy. Now, for that, you have to start exercising in this period. It's very, very important. And very important thing is, I see, even in my society, I see women, they're walking for 10,000 steps every day and they really flaunt about it. Aaj humne 10,000 kiya, aaj humne 15,000 kiya. But please understand, only walk is not going to help. With the walk, you need mainly muscle strengthening exercises. You would see that at the end of the day, all of us will end up with a calf muscle pain, पैर में दर्द हो रहा होता है, नींद नहीं आती है. All those symptoms are that your muscle strengthening is not very good. Okay, so that is what we need to work at. Emotional changes. Now, this I would say very much depends upon how you take the menopause. See, remember those days, if you can remember, when we had menarche. हमारे टाइम में कभी ऐसा होता था कि young girls को बहुत education नहीं देते थे, so there was a plus point to it also. We all had a very smooth menarche. Okay, suddenly one day we started bleeding. Our moms told us that, okay, this happens. And, it started in a flow. Nowadays, what's happening to our daughters? They take menarche as, it's a talk among the young girls on a daily basis. Tumhara hua, tumhara hua, tumhara hua. They're just waiting for that. So emotionally, you undergo a lot of changes, and that is what gives you problems. So similar is the case with menopause. Don't take it as a project. Let it come smoothly. Let it come like, the way menarche has set in and we have regular cycles, we don't expect it. Why should it go at normal? So if you think it that way, you will not have those mood changes and all at all. But even though you have it, suppose, we've got a remedy for that. I'll come over to that. Next comes your physical symptoms. Now again, in the pre-menopause, I don't expect that. But yeah, if you start getting hot flashes, if you start getting night
Flashes. What are hot flashes? So hot flash is a sensation of intense heat that can also cause sweating and heart palpitations. So
this is what I was talking about. See, lifestyle modification is important. Medical options, I'll touch it a little later with the menopause wala slide. Then stress management, this part is very important, Just maybe, even if you're not doing the yoga, just sit with a cup of tea and, just rethink. Or maybe this could be in the end of the day also, when you just want to wind up and go to bed. Just spend 15 minutes with yourself, take a deep breath and understand that, okay, where am I? I mean, are things settling in my life or not? So if you don't do that, and if you're always on your toes, you would undergo a bit, stress, and then again, the menopause is going to get disturbed. And mammography, I hope everybody knows about it, right?
So what is mammography? In mammography, each breast is compressed horizontally. During a screening mammograph, the breast is placed between two plastic plates. The plates that are briefly compressed to flatten of the breast tissue, and the two views usually are taken of each breast.
Right? And a pap smear, if you have not done up till now, please get it done.
So what is pap smear test? So gynecologist advises having a pap smear to detect the presence of any of the following conditions in the cervical area: abnormal precancerous cells, cervical inflammation or infections. So what is pap smear test? A pap smear test is used to screen cervical cancer in a woman, and the test generally involves the collection and examination of cells from the cervix region, which is lower and narrow end of the uterus, for the existence of abnormal cells leading to cancer.
As it is a pap smear, we do recommend the moment you get sexually active, you have to get it done. But if nahi karaya hai after 40, really it's important that go to your gynecologist, get yourself checked. Another important thing what I would say is that a regular checkup doesn't mean कि आपने फ्लेबो को घर बुलाया, साल में एक बार ब्लड्स दिया, टेस्ट करवाया, खत्म. No, because most of the time I see that nobody checked those reports. Nobody, actually advised, हमने अपने घर में देख लिया, सब reports normal, the सब normal. Okay, this doesn't really help, because at times, we have to connect the dots and see what is okay. The other important thing is, when you get once in a year health checkup done, please get one ultrasound done. Okay, one ultrasound to understand what's happening to your uterus, tubes, ovaries, what's happening to your gallbladder, what's happening to your liver, everything is okay, am I developing a fatty liver, all those things are really very important. So this is what we mean by a regular checkup. Still we are, researching into menopause, we are understanding what changes the woman goes through, and every day, day in and day out, there are new medicines that are coming over. Like off late, I would say up till now, we used to have, vasomotor flushes is like something which is very, very common. And everybody is scared कि हमें hormones नहीं लेने. Although it is not that scary a thing, but off late, very recently, it has come in the market in the last 6 months. There is a non-hormonal specific drug for vasomotor symptoms which has proven to be very effective. So the research is continuously going on, and then you need to be updated, be in touch with your gynecologist. Don't think that these symptoms are that you have to sit back with it and you have to bear with it till, you are another 10 years down the line. This is what the message I want to give, okay? Okay, so if you don't bleed for 3 to 4 months and then you have a bleeding. Now again, you don't bleed for 5-6 months, you have a bleeding. That is not menopause. So the first thing is that symptomatically, we want to ensure that you have stopped bleeding for 1 year, and very important is that if you have stopped bleeding for 1 year continuously, you should never bleed after that. Okay, so if you have, like say 2-3 years of complete stopping, and then even if you had a spot of blood, it means please go to your gynecologist. Don't sit with it thinking कि कुछ नहीं, थोड़ा सा spot हुआ था, ठीक हो गया. No, because there could be a uterus which has become atrophic, is not supposed to bleed after that at all. Right? So that 1 year is very important. Okay, let's forget about this history of menopause. Here we just wanted to say that in the olden days, menopause was really taken as a disease, and it was like that the woman has committed some sin, but we are far beyond it now. Okay, so what happens to our body? The physiology inside is that your ovaries, they've stopped producing estrogen as such. They don't stop it overnight, but it starts declining. Okay, so that's why these phases come of up and down, that at times you have irregular periods. Why? Because in that particular phase, the egg that was produced, that was not of a very good quality. So it took a little longer for it to release it, and then when it released, it could be that the lining got very thick and you started bleeding more. Okay, so that's the physiology behind it. We don't need to be worried about it, that why this is happening. But definitely, there could be other reasons, so we want to get it checked by the doctor. Okay, now again, these are the fluctuations of the hormones that is being seen. There is only one and only one hormone which needs to be tested, and that is FSH. Okay, now if you can remember the name, follicle stimulating hormone. So what is said is that if the value of this hormone is more than 30 2 times 4 weeks apart, you are into established menopause and we cannot reverse that. Okay, so if you remember just that one statement, no, you will not have any confusion. You will not even go to a gynecologist, and just understand that, okay, because my FSH level is rising, that is the reason my periods are becoming problematic. Okay,
FSH level is more than
30. Yeah. Some books they do say 20, but 20 thoda na transition hota hai. Okay, so this I've all covered, like what are the symptoms and all they happen. Okay, now हमारा cut off age जो होता है ना, like if you get those symptoms more than 45 years of age, I would not want to do any test at all. But if a woman under 45 years of age comes and says that, doctor, my periods are problematic, or I'm getting hot flushes, or I'm getting night sweats, then definitely I want to get an FSH done.
Is FSH test includes identifying the cause of infertility, determining the cause of your periods irregulations, and predicting the onset of menopause, and identifying the potential issue with the operation of brain.
Even nowadays we look at pregnancy at beyond 40 years of age also. So another very, very important thing is that after 40 or even till the age of 50 years, you cannot go off contraception till you reach a proper menopause. We have seen pregnancies that happen even at the age of 48, 49 years, when you think that ab to kuch bhi nahi hoga, right? So that is something really important. We just need one egg and one sperm for a pregnancy. And the problem is, when pregnancy happens at this period, it is a very complicated pregnancy. Even to terminate this pregnancy is a big task. So that is the reason why this vigilance is so important. So what I was saying is that the cutoff, the 45 years is the cutoff, you have to remember. And more than 45 years we do only when when you have a hysterectomy, you've got the retained ovaries, when you've got some hormonal contraceptives, जिसको हम HRT बोलते हैं, अगर उसके ऊपर हमने आपको रखा हुआ है, then we want to see that, okay, what is happening. Okay, now these are again, I'm sure these symptoms most of you know. Hot flushes होंगे. Hot flushes क्या होते हैं? You're sitting in an AC environment and your husband is feeling like ठंड हो रही है बहुत, and you feel, it's so hot, I need to lower the AC mode, and this hot flushes, they last for 2 to 3 minutes. You feel like जितने कपड़े पहने हो सब उतार दो, like you just want to get rid of all your layers, and after 3 to 5 minutes it's all okay, and you perspire, you sweat a lot. तो कई बार तो ऐसा लगता है, you feel as if like, am I having a heart attack? Why is it? What is this happening? But you have to, you may dress up in layers. At times you may be in a meeting, you may be in the office. You may be in a miserable state at that time. कुछ नहीं करना है, शर्ट पहन के रखा हुआ है, इसको खोल के निकाल दो. And just take the AC towards you, so that you can manage these symptoms on a day-to-day life. So that's what hot flushes are. Hot flushes, if they start like in a month, if they're happening say 2, 3, 4 times, I'm okay. I would just say that let's be on a lifestyle modification and let's just see how things are going. But if they start troubling you on a daily basis, we have to give you medicines. Then we have to go for a hormone replacement therapy. Night sweats is a similar thing. Changes in the menstrual cycle, I told you. Low energy levels, definitely yes. But again, low energy levels is a very, very what I would say, a very, it's not going to happen to every person. It depends upon your perception, how you're taking menopause. If you're taking it nicely and your vitamin D, your vitamin B12, your thyroid, all those levels are under normal, nothing is going to happen, right? Mood swings, this does happen. It is hormonal related, but there are multiple factors to it. At times you start feeling very lonely in this period. You're done with all your responsibilities. Your children have settled. Your husband is like, busy in his own world. You may not come across much of friends with whom you can communicate. You start getting those mood dips. So what is really important is keep yourself busy. That's why we keep on emphasizing that please do not pause after menopause. Don't think that I'm in the retirement phase. I mean, we women have been given that strength, that we never retire. And it's always better not to, right? Okay, skin changes, yes, you get those dryness in your skins. Again, if you go to a dermatologist, she'll give you all the tips, how to keep your skin hydrated, moisturized in this period. Poor sleep is more of related to your emotional EQ, how much is your emotional quotient. If you are very much okay, again, menopause itself will not lead to an insomnia, right? Now, vaginal dryness is a real problem. Again, see, I would want to say, don't let your sex life get hindered just because menopause has happened. If there is a vaginal dryness, we have to, we've got remedies for that. Initially, we give you moisturizers, we give you lubricants, but later on, if it doesn't work, we can definitely give you those estrogen creams and all which help you get over this thing again.
This is all what you are saying about the outer, you can say the superficial things. But then what about the inner feeling that I think you lose that interest in sex? That is.
See, again, I would say.
Is there no remedy for that or any?
Losing interest, what we say decreased libido, that may happen to a woman at any phase of life. Okay, it is not really connected to that because you're menopause. So, it is a part of this thing. It's more of linked to your vaginal dryness.
Okay.
One is vaginal dryness. That is something pathological which we can take care of. But the other thing is, spending time together with your partner. I mean, having that quality time. It's something like when you just deliver. If you remember those days, जब आपकी just delivery होती है ना, so the first 1 year, the sex life goes for a toss for everybody. Okay, why? Because you are so occupied with so many things, and the women will come back and tell us that doctor, I've lost the interest. It's not that you have lost the interest. It's only that you need to relive your life again. So that is what is also needed at menopause. Then after menopause, we say that live for yourself. Dress up for yourself. It's not that you've been doing enough all throughout these years, for your children, for your family, but start doing something for yourself and live up to your dreams. When you get that confidence, you will see your sex life is also returning back. So it's actually a redoing that happens after that, right?
Because I asked doctor about medicine and all, but then they had no cure for this.
See, it's not that there is no cure. There are medicines for decreased libido, but then we need to look at it whether you really need it. Okay, you can, sildenafil and all, they work very well in it, but it is not needed. It is not going to work because the cause over here is not sildenafil कब दिया जाता है जब आपके अंदर vasoconstriction है, dilatation नहीं हो रहा है, you're not getting that pleasure in sex. So that is usually not the problem with most of the women. The problem is usually one is time constraints. Meeting at the right time. When you want, the husband is tired. When the husband wants, you are tired. That sync doesn't happen. And the other thing is vaginal dryness. We need to take care of only these two things. Then the sexual life comes back to normal very fast. The unpredictable breast tenderness, that's another thing. But this is a very, very deceptive symptom. I would suggest if at any time at this age you feel a problem in your breast, please get yourself checked. Unfortunately, the incidence of breast cancer has become very high. Like in my practice over the years, I'm seeing in the OPD, it's rising like anything. Okay, so this is something where you have to be careful about, right? Okay, now let's come to a very important topic, hormone replacement therapy. Okay.
So Dr. Shweta Wazir have also given guidance on hormonal replacement therapy. So what is hormonal replacement therapy?
Hormone replacement therapy क्या होता है? जो हमारा estrogen fall कर रहा है, we try to give it from outside. Okay. Now initial phase में, when you just come to me with very minor symptoms, my first step would be, I would say LSM, lifestyle modification. What that involves is what I've been talking up till now. You need to go for your regular walks. You need to start, mentally living up for yourself. You need to see to it that you're spending some time doing those anti-stress, formulas, whatever has been quoted everywhere. Start taking something like in the form of seeds, like, omega-3 fatty acids, all those kinds of stuff, which is going to de-stress you. And start enjoying your work. That is what we call as lifestyle modification. If it doesn't work, then my next step would be, step by step. If you're having a vasomotor symptoms, I will not hesitate to give you an HRT at all, because that works wonders. And HRT is what? We are giving you estrogen from outside. If you have a uterus, we give you progesterone along with it. If you don't have a uterus, giving estrogen enough is good enough. Okay, right? So for vasomotor disturbances, for mood or sleep disturbances, again mood changes ke liye, the best thing is first we send you for a cognitive behavioral therapy. That's called CBT. That's usually done by a psychologist. If that doesn't work, the next thing comes like what we say in SSRIs. They are selective serotonin reuptake inhibitors like sertraline, fluoxetine, ये सब नाम अगर कभी सुने हो. So they are also very mild medicines, but they help lift up your mood if you are in that phase. If it doesn't work, the next would come as HRT. Generally, इसमें क्या है कि when you are giving an HRT, it has to be supervised. It cannot be कि मेरी फ्रेंड ने मेडिसिन ली तो मैं भी इसको खा के देख लेती हूँ और मैं 3 महीने के बाद डॉक्टर के पास जाऊँगी. Don't do that mistake, because these are hormones. You can't take them on your own. Right? Again, osteoporosis. Now, this is a very, very important thing. Another health check, what I forgot at that time is, after the age of 40 years and specifically after the age of 50 years, please get a bone mineral density done. Okay, you may come across your mother's mother-in-laws. बहुत common होता है उनका, चलते चलते कोनी टकरा गई दरवाजे से, यहाँ का फ्रैक्चर हो गया. For no reason we think that what happened. Okay, मतलब रोज जाती है, रोज चलती है, थोड़ा सा पैर ऐसे ट्विस्ट कर गया, एंकल का फ्रैक्चर हो गया. So these are fragility fractures. Why they happen? Because your bones get demineralized. So we have to continuously keep on checking with our BMD. Are we going towards the osteopenic side? Are we going towards the osteoporotic side? And everything has a remedy. If you are osteoporotic, there's a medicine called biphosphonates which can be given. They're just popping in a medicine, that's it. Or maybe on an injectable, and they're very much remediable. At least you'll be saved from those nasty immobilizations. एक बार hip का fracture हो जाता है, you just go for a life goes for a toss for the next 6 months, right? Okay.
So what is colorectal cancer?
Somebody who's got this colorectal cancer का history in the family ना, उसके लिए तो हम screening बहुत regularly करते हैं. It's more of a gastroenterologist subject, but ideally उस case में फिर every year colonic biopsy होती है. There are a lot of things that need to be done, but it is said that HRT has got a benefit against that as well. So somebody who's got that family history, we would be screening and we would be deliberately starting them on HRT. Okay, so
Excuse me, ma'am.
Yeah.
Ma'am, for mood disturbances, how much is primrose oil beneficial in that? There's a lot of hype about
I'll
it
tell you
nowadays in Absolute Women and a lot of multivitamins which are specially designed for women. This ingredient is there.
So I will come to that. See, there are some non-hormonal treatments. Now, not just primrose oil है, कुछ हद तक advocated है. Now there are a lot of other things you will come across on the net. Caspary extract, vitamin B6. There's something called St. John's wort. All those things, especially जो patients US से connected है ना, वो Amazon.com पे देख के definitely आते हैं. Okay, so इनका सबका क्या है? To some extent they are beneficial. Okay, but again there is some drug interaction. जैसे जो black cohosh होता है, that causes a liver toxicity. Okay, something called red clover, it causes a platelet aggregation. So there are some contraindications to that. कि अगर if you are predisposed to heart diseases, I would never be recommending a red cohosh to such a patient. Like if you've got a fatty liver, I don't want a black cohosh to be black clover to be given to it. Other people, red clover and black cohosh, right? Then similarly, evening primrose oil is amongst all of them the least harmful one. Okay, so you can go for it. To some extent, it could be hard. It could be good for you, but you have to see. Give it as an experiment for 3 months.
I'm taking Absolute Women. It has this ingredient, and what I have observed, like accidentally when the stock gets over, so I have observed some mood changes. So then I researched, and then I found that, and discussed it with my husband. He's also a doctor. So then I found that yes, primrose oil. He told me that in menopausal age, gynecologists do recommend this particular thing for mood swing. So I noticed that when my this Absolute Women gets over and I don't buy it, I don't bother to buy it in those 10-15 days. Yes. I have
So
Could be psychological.
yes, so I'll not say psychological.
No, it's not
See, I'll tell you some medicines we use a better word for that. I will not disagree with you completely, but we use a word called placebo for it. Okay, placebo क्या होता है कि आप जैसे ओरल कॉन्ट्रासेप्टिव पिल्स लेते हो ना, उसमें 21 टैबलेट्स, किसी किसी में 30 टैबलेट्स होती है, तो 21 टैबलेट्स से आपके पीरियड्स का रेगुलेशन होता है. लास्ट की जो 7 टैबलेट्स होती है प्लेसिबो होती है, बिकॉज वी डोंट वांट यू टू नॉट टेक एनी मेडिसिन. वो कुछ नहीं होता उसमें, सिर्फ पानी होता होगा. राइट, हाँ, एग्जैक्टली. तो evening primrose oil is not exactly placebo, but it doesn't have that much of evidence. Okay, now whenever we quote a medicine, no, like if I give you estrogen, I know for sure that this medicine is going to work in, if not 100%, in 95% of patients. Okay, so that's the reason why we say that you should not, if you're really having a vasomotor flush, then why not go for a proper treatment instead of just going about here and there, right?
So different sort of discharge we sometimes get.
We have asked so many questions related to vaginal discharge also. So color of the vaginal discharge and what exactly they mean.
Brown, yellowish.
Brown you should never get.
Okay.
Brown means a bleeding. Okay. Now yellowish, if you're getting vaginal discharge at any time in your life, if it is associated with itching, it is bad. It is pathological.
Okay.
Okay. But if it is just a discharge, see, pre-menopausal phase, you may get a discharge. But again, if you're post-menopause, your vaginal secretions are more or less becoming zero. You're not supposed to get a discharge. Okay, so if you're getting, get yourself checked. What I was trying to say.
So what sort of discharge is normal? Like suppose I had a green discharge once. So I went to Dr. Preeti Agarwal and she suggested some intravaginal medicines which I've inserted.
Right. So in the pre-menopausal phase, with the discharges, 3 things. Number 1, should not be offensive smelling. Number 2, should not be associated with itching. Number 3, you should have dry days at some phase of your cycle. Immediately after bleeding, 2-3 days के लिए discharge हो रहा है, it's okay. Immediately before bleeding, 2-3 days discharge हो रहा है, it's okay. In the mid-cycle phase, discharge हो रहा है, it's okay. But what it means, like if you started bleeding on day 1, day 6 to day 12 or day 11, you should be completely dry. Okay?
You should be, I mean,
yeah, you should
if
be
there are
completely
some slimy on the walls of vagina.
No, if you're having some discharge, that means please get yourself checked.
Okay.
Then again, once you've ovulated, suppose you ovulated on day 16, 17, the ovulation will be hardly for 2 or 3 days. So again, from day 18 till day 24, 25, I expect you to be completely dry.
Okay.
Right? So it should not be that your panty is always getting stained. That is it now.
No, it's not that panty is getting wet. It's like some discharges around the walls of vagina. When we clean, when we wipe out.
That could be a hygiene issue also.
Okay.
Because see, when you take a bath, we say that water is the best thing. No soap, nothing
Correct.
to be applied. You know that, no? So you have to separate your labia like this, I mean, you have to teach this to your young little girls also.
Correct.
I mean, the girls, they don't take a bath properly, you have to tell them that please separate the labia and clean it properly, what they normally miss on that.
With normal water,
Yes,
no
yes,
V-wash and
absolutely.
anything.
No V-wash to daily ka kabhi nahi use karna.
All right.
I mean, keep on, literally yelling at the patients that please stop giving advantage to the commercial, pharmaceutical companies. Huh? Actually, what I was missing over here is a recurring UTI. That's another symptom what you get if you are getting vaginal dryness and if you're prone to UTI. Like, in 6 months, if you get more than 2 episodes. Okay, it means that apart from a general physician, please go to a gynecologist because she will assess, is it because of the urogenital epithelium not being formed properly that you're getting predisposed to urine infection. Okay, and then she will give you some local estrogens to get rid of that. Okay, I think again we have discussed everything. Prolapse may happen at times, but थोड़ा सा unusual होता है, not because of menopause. अगर prolapse, you understand, the uterus starts coming out. Okay.
So Dr. Shweta Wazir has really focused on Kegel exercise, which actually is a contract, hold, rest and relax. It is very, very important exercise for all the women who have a normal delivery, and it is very important so that आपका uterus, जो prolapse हो जाता है, इसमें ये काफी beneficial रहता है. If you do this exercise, it's like contract, hold, rest and relax. So it is very, very important Kegel exercise you all must do.
So
That's
for many
another-
elderly ladies this happens, right?
Yes, it happens in elderly, but I'll tell you one more thing. Sometimes women, they live with it. Prolapse doesn't happen overnight. या 15-20 दिन में या 2-4 महीने में नहीं होगा. Prolapse
How
happens
is
over
that,
the days.
वो क्या symptoms होते हैं, कैसा होता
You'll
है?
feel heaviness
So,
lower down.
हाँ.
You would actually, when you cough, you will feel that something is dropping down. You will feel that something is dropping down into the vagina. And when you have to pass urine or stool, you have to strain a bit. आप easily जैसे hesitancy होती है, आप जाके सीट पे बैठो, तुरंत यूरिन बाहर नहीं निकलेगा, because the uterus is pushing down and it is kind of obstructing on the bladder and the rectum. So these are very early symptoms which we tend to neglect. Get yourself checked. Now if it is in the very initial stage, जैसे जिसकी 1 or 2 normal deliveries हुई होगी ना, उसकी maybe in the later part, if you have not done your Kegels. Now this is something very important that postnatally everybody should do. If you have not done your Kegels and in the later part there is a high probability you will have a prolapse. Now when you are in the first degree or in the second degree of prolapse, now it can be very well managed by Kegels at that time. Otherwise it has to be a surgical correction. कुछ नहीं कर सकते. Then we happen to lose upon the uterus.
So my mother-in-law had this. So there was a ring put inside,
Yeah.
because she would not be operated because of her age.
That's another option. That is more of gaining time. Ring pessary is to give a comfort to the patient. Like 70-80 years हो जाते हैं, बहुत morbidities बहुत रहती हैं, hypertensive है, diabetic है, they don't want to go for it. तो फिर हम बोलते हैं कि अच्छा रिंग डाल के उसको वहाँ. It's just a support system, that keep it over there, and they will not have those pressure symptoms of urine and bladder. But that's not a definite.
Yoga and some postures as well.
Only stage 1 and 2. See, when it crosses that stage 2, 3-4 को manage करना is not possible. Then we say that get a surgical correction, because it is going to be there till you die. Why do you want to suffer? Okay, and it is going to increase over the time. और फिर आप कुछ exercise नहीं कर सकते, आप कोई jumping jacks नहीं कर सकते. You can't do any cardio with those prolapse coming out. So it's better to get itself operated, right? Okay, next, I think not much yet. So this is. Again, the therapy for vaginal dryness I've already discussed with you. 3 things. Number 1 is a moisturizing cream. Now, it's not a usual Nivea wala wo sab moisturizer nahi. We get lubricants in the market which needs to be put. I mean, something like very common names I'll tell you. KY jelly hota hai, what we use for for sexual intercourse also. KY jelly, lubric jelly के नाम से आता है. तो ये सब 1 or 2 are very common things which you can use over the counter also. If it doesn't work, then the next thing will be estrogen creams. Estrogen creams never unmonitored. Go to your gynecologist, because उसमें एक major thing क्या होता है ना कि आप उसको एक stretch में लगाओगे, फिर उसको धीरे-धीरे taper करना होता है. We can't do it like this कि we used it for a month, अब बहुत अच्छा हो गया, अब उसको बंद कर दिया. We can't do it like that, because then it will cause withdrawal symptoms, bleeding शुरू हो जाएगी, and then you become very petrified, right? Okay, so this is one thing that needs to be kept in mind. What's else? Good slide. If you have a family history, your moms, नानी, किसी को regularly अगर fractures होते आ रहे हो, तो definitely get your BMD done annually. If you have an early menopause, that's very important factor, because see, our estrogen is important for our heart, for our bones, for our skin. Even vitamin D levels are maintained if you have a good estrogen in your body. So if we lose estrogen, sometimes the women, they get so fed up with their periods, we even get requests, they come at around the 40 years of age, doctor sab nikal do. बोलते no. I mean, you're not a child producing machine कि आपने बच्चे पैदा कर दिए तो आप uterus निकलवा लो. You're not going to do that. Now, the government thankfully has become so strict. Less than 45 years, अगर हम किसी का hysterectomy करते हैं, we have to fill up a full form, we have to send it to the NCG, and we have to give an explanation that why the hell are we removing the uterus of this woman. Okay, so that's a very good move that has happened of late, right? Then again, if you're smoking, if you have a history of stretch factors, thyroid disorder, that's another important thing. Osteoporosis, thyroid disorder se bahut jaldi set in karta hai, so we need to be careful about that thing as well. Emotional change, now this we all know, fatigue, difficulty concentrating, all these things, if you manage your life well, I mean, start switching over to that routine, early to bed, early to rise. Please don't get up at 10, 11 in the night, even if you are like free, don't do that. Go for your walks, socialize with people, like-minded people, and even if you have not been working, engage yourself now. now pursue all your hobbies which have been lost, because of your work commitments up till now, right?
Yeah, she said one thing, that is menopause doesn't mean that you need to stop your life. So it's me no pause, so I'm not gonna stop even if it is a menopause. So live yourself, dress up for yourself, and enjoy your life, and live some sort of passion in you in when you are around the menopausal age, so pursue some sort of dreams and passion which you really enjoy. It really has a good impact on your life.
Okay, so that's what is going to help you. Emotional changes are, whether we do have therapies for that. I will not say that we don't have therapies, but first try to manage on your own. उसके बाद हम step by step चलते हैं. We go for a cognitive behavioral therapy, we go for an HRT, and another one is we go for even testosterone. Testosterone works very well in mood disorders, right? Okay, so this is again for low libido.
Pardon doctor, testosterone तो मेल के लिए होता है ना?
नहीं, but females में testosterone होता है.
होता है,
Yes. So androgens, a small part of androgens is present in our body as well. So that's the reason why we say that they work very well to stimulate a female also, right? So इसके proper gels आते हैं, proper tablets आती हैं जो females को दी जाती है फिर वो deficient in that, right? Now again, treatment for low libido step by step यही होता है. What I told you, first manage your life. We've got medicines like Tibolon, HRT, testosterone gels and patches. This is what this slide is saying. We've already discussed that, right?
I'm 41 and there are nothing I don't have any regular treatment, nothing like that, but I have mood swings and thought trouble. It is a symptom of premenopause.
See, at 41 अगर हो रहा है ना, सबसे पहले अपना FSH टेस्ट कराओ. Let me just see whether you're actually going down on your hormones, because mood swings could be connected to some kind of stress what you're going through in your life. So I cannot attribute everything to menopause. Right? पहले diagnose करो that it is menopause, then you go ahead treating that.
Okay, and sometimes it's hot. Just you say it's for 2-3 minutes.
40 years पे, see 40 years से ना hot flushes अगर आ रही हैं, I would put menopause as the last cause. Okay. First look at other things. Check your thyroid. मतलब एक proper एक पूरा checkup कराओ.
अभी just I
एक मेरा है, मेरा 43 में मेनोपॉज हो गया था. अभी मैं 46 की हूँ. और मतलब मैं ये पूछना चाह रही थी कि ये तो आपने सिम्टम्स पहले के बताए, प्री मेनोपॉज के. आफ्टर मेनोपॉज जैसे मेरा अब हो गया, तो अभी कुछ प्रिकॉशन.
Your regular health checks. 43 is definitely less than 45. Okay. Now we don't put you in a high risk category because हम less than 40 को बोलते हैं कि you need to be very careful about everything. But still, a regular cardiology checkup. Maybe once in 2 years if everything is okay. Bone checkup should be every year. The bone mineral density. Your mammography should be every year, and a pap smear if it is not being done. It is not every year advocated. अब हमारे pap smear के टेस्ट इतने beautiful हैं. We say just once in 5 years.
लास्ट ईयर हुआ था, तो अभी
if it was completely normal and if an HPV DNA was done. Some gynecologists are still not doing HPV DNA. So if a simple pap smear was done, the test comes after 3 years. If you're doing an HPV DNA, it comes after 5 years. ठीक है. So ये सारी चीजें जरूर कराओगे. बाकी a lifestyle modification, you're definitely going on your regular walks. Even if you're on a very healthy weight side, it is important for muscle strengthening. For your walks and for your yoga, you have to do your exercises. Just going to the
रेगुलर रहती है और सारी स्ट्रेंथ एक्सरसाइज ज़्यादा रहती है.
strength exercise.
कैलिस्थेनिक करती हूँ मैं, तो स्ट्रेंथ एक्सरसाइज काफ़ी है. तो मतलब उससे कोई ऐसा तो नहीं है कि इस एज में आप इतना ज़्यादा एक्सरसाइज कर रहे हो कि आप रोटेट कर रहे हो अपने आप को.
कोई फर्क नहीं पड़ता. There is no age part to exercises at all. It depends upon how much flexibility you give it to your body.
Okay.
Okay.
Second thing, obesity will cause all these problems of knees.
Absolutely, your weight is increasing, things are going to be problematic. So, and obesity, see, I'll tell you one more thing. Women at this age, we get very frustrated and irritated with ourselves. Every day I'm facing this question. I'm weight lose नहीं हो रहा, हम कुछ नहीं खाते हैं. And actually, if you go into their diet, they're not eating. Okay, I mean, I probe them. Okay, मुझे morning से लेकर रात तक बताओ आपने क्या क्या खाया. Problem कहाँ होती है ना? Because your metabolism slows down. Exercise करनी पड़ेगी. You can't expect that you suddenly start starving and your weight will go down. when you were a young girl, you were running around here and there. आप जितना भी खा लो आपका weight नहीं बढ़ता था. अब your metabolism has slowed down. It is going to increase. We can't do anything about it.
You can't be overfed and undernourished.
Yes.
Or
Absolutely control your taste buds now. You know, all these 40-50 years we had a gala life, we ate a lot, we ate everything. अब नहीं, अब वो जो बोलते हैं ना हमारे जो हिंदू माइथोलॉजी में होता है, I'm not asking you to stop. Exactly. You know that concept is because of that reason only, ना? तो इसका मतलब ये नहीं होता है that you stop enjoying your life. I mean, it depends upon कि आप अपने mind में enjoyment क्या चीज़ को बोलते हैं. You know, what's the definition of having fun? That's what is important, right? Okay. Anything else? Actually, tell me, everybody of you have got your pap smear done?
Yeah.
Just one question. 100% no? Just one second. Anybody who's not got done, please raise your hands. There's nothing embarrassing in it. Okay, I would really request you give yourself a week's time. एक हफ्ते के अंदर पैप स्मेयर हो जाना चाहिए. This is something you know really very important. और मैमोग्राफी भी जिसने नहीं कराया है, maybe you know next 15 days keep a target that you'll get a mammography done. You know then.
Done in every year or?
If you have done simple pap smear, it is every 3 years. If you have done pap smear plus HPV DNA, it is 5 years. Okay, it's a very simple test. किसी को डर तो नहीं है माइंड में कि pap smear दर्द होता है?
It's a very inconvenient procedure. So not
It's very simple, not so inconvenient.
I tell you what, I expected this answer. I always in a forum get a mixed opinion. Always in a forum, if I tell women to raise their hands that how many find it scary, it would be like 10 would say scary and 10 would say it was very easy. Okay, now where the difference is, when you're getting a pap smear done, okay, now if any of you have delivered vaginally, सब vaginal delivery के बिना mixed opinions होते हैं. Somebody would say that मैम ठीक था, मतलब इतना भी difficult नहीं था जितना videos में लिखा होता है, right? कुछ बोलेंगे नाइटमेयर था, हम दोबारा कभी नहीं कराएंगे. Now why that difference? Okay, और say for example even a small internal check, हम जब पीवी करते हैं पेशेंट्स का, कुछ ऐसे रहेंगे कि it's okay, we got it done, right? Somebody would shout so much कि in the OPD the MD would come to my room, you know that ma'am what are you doing, right? Okay, so why that difference? Now again you know it is a perception.
Yeah.
Okay, you have to understand. पैप स्मेयर कराने के पहले मोस्ट इम्पॉर्टेंट क्या है, फॉर दैट मैटर कोई भी प्रोसीजर कराने के पहले पढ़ के जाओ. यू नो देयर आर वीडियोस, एन नंबर ऑफ वीडियोस ऑन द इंटरनेट. आप पढ़ के जाओ पैप स्मेयर टेस्ट क्या होता है. इट शुड नॉट बी लाइक
ये कर देंगे हमारे लिए न्यू है. मेरे लिए
I'll tell you what, you're supposed to lie down on a table, on an examining table. There's a small instrument called a speculum. You may have seen it at the time of your deliveries, also your gynae checkups में. वो speculum steel का होता है या फिर कभी-कभी plastic भी होता है. But in either ways, it is going to be uncomfortable. Okay, anything going into your vagina, nobody is going to like that. So what you have to do is first tell yourself it is not going to hurt. Mentally अपने आप को prepare करो. वो speculum अंदर जाएगा, थोड़ा सा gynecologist उसको खोलेगी. जब तक वो खोलेगी नहीं उसको cervix नहीं दिखेगा. ठीक है? फिर we take a brush in our hand. We touch the mouth of the uterus, that is the cervix, with the brush, and we rotate it 5 times.
My
Okay. My goodness. It takes 5 seconds. अगर मैं उसको ऐसे 5 बार रोटेट किया, उसके सेल्स वहाँ पे चिपक कर हमने भेज दिया. That's it.
That's very simple.
See, if you do it in a, I mean, you know, with an open mindset, you don't take food into
Result should be there out of it.
What?
Result should be there out of
What results? Okay, pap smear tells me that is the cervix undergoing some changes that may lead to a cancer, say 10 years, 20 years from now. It's such a beautiful test, and you know, women are privileged. हमारी reproductive organs का कोई भी cancer अगर हमें होता है, we can get rid of that immediately, you know, and lead a completely healthy life after that. Okay, so that's a very major advantage, and that's why we so much advocated कि breast cancer होगा, breast काट दिया जाएगा, uterus cervix का cancer होगा, uterus cervix काट दिया जाएगा. It doesn't affect your longevity. You know, the prognosis after that is like 100%, close to 100% survival rate if it is diagnosed in the early stage. So why not get these preventive tests done, right? Okay.
My question was, if the person has got hysterectomy done,
Yeah.
is the pap smear still required?
Yes.
No.
One. If you have never been in the pap smear program before, हम उसको wall smear बोलते हैं कि कई बार कैंसर ना स्टम्प पे आता है, मतलब where you stitch the uterus. So one wall smear 6 months post hysterectomy is a must.
Time it was done like now.
Then you don't need. Absolutely not. That was okay. ठीक है. What's your question?
What's the difference between pap smear and HPV DNA?
Okay. Now, pap smear again, it is an obsolete test. There is no pap smear anymore. We don't lose this terminology because everybody knows it by this name. We have got an improvised terminology with what we say liquid-based cytology. Pap smear क्या होता था पहले के टाइम में? I've done it as a student. So what we used to do, we used to touch the cervix and हमारे पास एक slide होती थी with a cover slip. I hope you understand this terms, ना? तो हम उस पे उसको खींचते थे, slide बनाते थे, cover slip लगाते थे, pathologist के पास भेजते थे, ठीक है? Now उसमें problem क्या होती थी? There was an incidence of 9% false positive results. Okay, so false positive का मतलब क्या हुआ? कि आपको कैंसर बताया गया है, but आपको कैंसर नहीं है. That is horrendous. I mean, you know, like till the time we prove it कि आपको कैंसर नहीं है, it would be like a miserable life for not just for you, I would say for the doctor also. Okay, right? So we improvised on the test and we developed a test what we say liquid-based cytology. Liquid-based cytology में क्या होता है? हम slide नहीं बनाते हैं, हम brush को 5 बार रोटेट करके और हम ब्रश को तोड़ के वो ब्रश भेज देते हैं पैथोलॉजिस्ट के पास.
ब्रश के साथ जो चिपका होगा सेल्स.
Yes, so he only has to stain it, he only has to make a slide and there is no, you know, loopholes in between कि इस point पे contamination हो सकता है. Okay, so इसके साथ में हम एक HPV DNA करेंगे. HPV DNA क्या है ना कि see, like COVID has got a virus. Okay, there were 2 tests for that. एक तो रैपिड एंटीजन टेस्ट होता था और एक एंटीबॉडी होता था, ठीक है? तो हम क्या करते थे? हम कोविड वायरस को ढूंढते थे कि वो वहाँ पे है कि नहीं, राइट? HPV इज अ वायरस दैट कॉजेज कैंसर. तो हम ह्यूमन पैपिलोमा वायरस का DNA चेक करेंगे ऑन योर सर्विक्स. ओके, एंड वंस वी नो दैट द DNA इज नॉट देयर, we are more foolproof that there is no cancer in the next 5 years. So that's the reason why we say nowadays, you know, I'll tell you in motherhood, we have stopped doing LBC alone completely.
What is LBC?
LBC is liquid-based cytology. What I just explained, just a brush the
After these like cervical cancer vaccination, if it is done all the 3 doses, then also this HPV DNA
Yes,
is
it has to be done. Now again, a very important question: why? There are 33 strains of HPV which cause cervical cancer.
and
Okay.
there are some latest because now I have to give it to my daughter.
I'm coming to that. I'm coming to
You
that.
recommend that
With
also?
initially we had Gardasil 2, Gardasil cervix के नाम से आता था. Then we had Gardasil 4, which was against 4 strains. Now we have Gardasil 9, which is against 9 strains. Now we are evolving. Okay. Now we know that we have covered 9 strains. So your sons and daughters, whoever are getting vaccinated, vaccinate them with Gardasil 9.
And we got it done, so we cannot get it done again with the latest one.
कर सकते हो, मतलब it will not turn out to be that cost effective. No? It's a costly vaccine. So you can wait for a couple of years and then get it done. Maybe your Gardasil 12 comes over.
Yeah.
Okay, right? Okay, and I hope you all know that it is not just for the daughters, it is for the sons as well. सबको पता है.
That was a question.
Okay, so please don't think.
I was just saying this, thinking करे हमें कुछ.
The concept is before the child becomes sexually active, get them vaccinated. Okay, now this age could be 9 years, this age could be 12 years, 15 years, but less than 15 years में पूरे पैसे बचेंगे, सिर्फ 2 डोज हैं. More than 15 years में it is 3 doses.
For the cervical.
Cervical.
There is no vaccination for adults, like
No, this vaccine can be taken for adults.
like for us also.
Yeah.
After marriage and all.
The efficacy would be less. You know, for a young girl who is a virgin, the efficacy is 98%. But for somebody who's been sexually active for years, the efficacy will fall down with every passing year. So the government permits us only till 45 years of age. Okay. But you know, if you ask me as a doctor, we feel that there is no harm in taking, like somebody who comes at 46 years of age, हम उसको मना नहीं करते. It is against our guidelines, but you know, guidelines keep on evolving. इससे पहले गवर्नमेंट ने बोला था 26 years तक ही देना है, but still at that time we were given from 26 to 45 also. Okay, in the private practice, because we feel that there is no harm in giving that vaccine, even if it gives you 10% protection. It is a protection. It is just draining you from your pocket, but it is definitely giving you an advantage.
Doctor, please come again. Is it for boys also?
Yes. Now tell me why.
Why?
The boys don't have a cervix.
And HPV
there are two reasons. One, it is a concept of herd immunity. Herd immunity means what? Till we don't do a mass vaccination, the disease cannot be eradicated. So अगर हम boys को नहीं vaccinate करेंगे, girls की cervix से नहीं हटेगा, ठीक है? Second concept is the HPV is not just for cervical cancer. There's something called genital warts. Heard about it? It's a very nasty STD, sexually transmitted disease. Then HPV has got some connection with head cancers, okay, laryngeal cancers. मतलब इसमें सब में human papilloma virus involved होता है. So that is the reason why we started saying that please advocate your sons as well. I mean, so that we can just we can get rid of it completely forever. Okay. Any other question?
I think all questions are done.
How is this HPV DNA test is done? Like you
The
explained
same
about
thing,
vaccine,
same thing. कुछ नहीं करना है. कोई मतलब वही एक ही टेस्ट में LPC और HPV
The
दोनों
process is
होता है.
same.
Okay.
Process is same. Few hundreds cost ज़्यादा होगा. बस इससे ज़्यादा नहीं, because it's just like they have to do some things.
Cervical cancer vaccination is must now, or is that?
See, I'll tell you, anything in the healthcare system is not must. We always offer that this is good, this is not good. Okay. Now it is kind of option. See, my duty is to let you know what is healthy. Now whether you want to remain healthy, that's your decision, no? Okay. But cervical cancer, definitely, see, we can tell you that it has got a benefit. This is the efficacy. This is how, it is being given. But then you'll have to see, at times, see, the one vaccine, it costs around 11,000 rupees. So it is expensive. Somebody may not be ready कि हम 30-40,000 हम spend करें, doctor, and you're saying it's only a 40% efficacy. I mean, why should I spend so much? So that's your call. You have to take it. We can't cut down on the cost till the vaccine is like too popular in the market, right? Okay. Thank you so much.
So thank you, Shweta ma'am. So this is Dr. Shweta Wazir, and we had a great learning session today. Thank you so much for clarifying all the questions. So we'll keep meeting, and thank you so much for your guidance. Thank you.
It was my pleasure to have such an impact.
तो यहाँ पे सेशन लिया हमने, तो प्रॉपर डॉक्टर ने आके हमें बताया कि
Dr. Shweta Wazir, yes.
हाँ, वजीर, डॉक्टर वजीर ने हमें बताया, तो काफी सारी अच्छी हमें इंफॉर्मेशन मिली.
Correct.
और मे भी हम आगे ऐसा करते रहेंगे.
Definitely.
जुड़े रहिए साथ में.
बिल्कुल
और
बिल्कुल. So it was a great session. हमें बहुत अच्छे क्वेश्चंस हमने पूछे, उसके आंसर्स बहुत उन्होंने हमें बिल्कुल सटीक आंसर्स दिए थे. जो भी हमारे क्वेश्चंस थे, सब क्वेश्चंस को आंसर किया डॉक्टर श्वेता वजीर ने. एंड आई एम सो थैंकफुल टू मदरहुड जिन्होंने हमें इनवाइट किया एंड गेव अस अ ग्रेट गाइडेंस.
एंड थैंक यू टू मंजरी जो इतना सब कैप्चर कर रहे हैं. ये भी बहुत जरूरी है ना, लोगों तक जाना बहुत जरूरी है.
It's my duty to create awareness among all the women. And Preeti is one of the lady, she's always inspires me and she always motivates me कि मंजरी लगी रहे, keep doing. कम दिखती है but दिखती रहती है. So yeah, please come. आ जाओ.
This is for you.
Oh, thank you so much Sonia and Preeti for giving me this great hamper. Thank you so much.
Thanks for
तो
coming
क्वींस
and
क्लब
thanks
के
for
साथ
joining
आप
us.
लोग जुड़े रहे. हम लोग और भी इवेंट करेंगे. थोड़ा क्वींस क्लब्स के साथ आप जुड़े रहिए. हम लोग और भी फन करेंगे, मस्ती करेंगे और इतना इंफॉर्मेटिव हम लोग सेशंस भी करते रहेंगे ना. तो
स्टार्टिंग तो फ्रीक्वेंटली हम ये कुछ अरेंज करते रहेंगे. नेक्स्ट मे बी इट विल बी द फिजियोथेरेपी सेशन.
हाँ, या
Correct. No, it's
Thank you,
great
Manjri.
learning. It's
Thank you
great
so
learning. और आप
keep
लोग
support Manjari as well. Subscribe her and press the bell icon.
Oh, thank you, darling.
Thank you.